Welcome back, Buddy here. And if you're watching this, you probably had knee surgery like me. This is 2 months out. So let me squeeze this up a little closer and we take a good look here. I am now able to first move my knee like this. I was not able to do that before. I can pull it back. I can extend it. All these motions are good. And I would say that's 90% of where I was. If I'm driving, I'm able to move pretty quick here, so I'm able to drive again. I do have one more x-ray left post-op, but I would say I'm 90% good. Where am I not good? So if you're 60 days out from your surgery, yes, that first week or two is going to be hard. The first month is not fun. I do have a video showing the first month. I have another video showing a few weeks after. But now at 60 days, everything's going to be good. So if you're watching this, you probably had knee surgery. As you see, 60 days, you're able to get back most of your function. So what I can't do though first is I'm not going to be jumping jacks. I'm not going to jump. I'm not running. So those are the first three more physical exercises. I would say those are more athlete things. I'm not comfortable doing those. I'm not going to be jumping anytime soon, especially at my weight. Now, what I probably should be working on is weight bearing. So if you see I hold this, I don't put much weight on this. So right here, I can do this, no problem. Now, if I try to do it the other way, I'll try to put this foot there, ain't gonna happen. So that's where even 2 months out, those are the things that you're gonna have issues with. But what I want to talk about today is the scar tissue. First, you're gonna have the actual scar here, and what they recommend is you rub, give it a massage, you do some pinching like this, but you have scar tissue, which keeps it real tight. So what that means is I can't get much loose skin out of this. And I pinch it, there's nothing there. So what they recommend is if it's flat, you can kind of do this, go back and forth like that, move your kneecap around, go back and forth. If you have it like this, you can do some pinching, massage. And what that does is it tries to break up the scar tissue, tries to get your skin a little more like elastic, that's the right word. So what I'm doing here is that, also the actual scar, that's the big part right here. You can see that it's a little more scarred there. You can massage those areas because underneath it, it is actually worse. So that's what I'm working on now. And that's where hopefully you'll be at 2 months out. Just to compare, I'll back this up a little bit. The chair is the big one. So I work in an office. I have to sit down. I travel, it's a travel channel. I have to sit in the airplane, I have to sit in the car. So this right here was half the battle. Now that I can sit and I can focus on getting up and down, I do recommend having a support. If you just have the chair here, you're gonna have to push up off the chair. Is it doable? Yes, I can obviously do that. Life is easier, especially if you're heavier. You have a table here, put your arm here, get a little support, and you just push off like that. So sitting, that is one of the biggest deals. I'm able to do that so much easier. But let's show you that, that little knee thing here. So this is the good knee. As you can see, I have a lot of extra skin. And that's what I'm working on. There's no scar tissue here. Able to do little pinch here. I'd say I have a whole finger. I lift this one up. I try to do the same thing. It's not gonna happen. So that's what I'm working on now. Hopefully you'll be in the same area. You'll be able to get up, be able to sit, and be able to work. Pull your knee back, pull your knee up, kick, drive. So 2 months out, I would say daily functions are back to pretty much normal. But now I'm working on getting back to a more physically fit status. First, I need to work on the scar tissue here. Hopefully get it where I can get something a little more than just this right here, this little pinch is not enough. Hopefully break this scar tissue up some more. But I do have good motion. I am able to get up here. Like I said, if you can get support, your chairs, some way to get up a little easier if you do find yourself needing that. So I do have the table here, it makes it easier. But besides that, yeah, I do feel like it's very much within 2 months that you will be back to mostly normal. This is still very tight. It feels like a tight ball. When you stretch and you feel like you're stretching too far, that's kind of the feeling that it has. I do massage. I'm trying to get all that tightness out. And that's what the 2 month mark is. So hopefully if you're watching this, you're having knee surgery, just know that it's not the end of the world. The pain as far as breaking your kneecap, breaking a knee joint, that initial pain is far worse. The first day, the injury by far was the worst pain. After that, the pain medicine helps. I did get off pain medicine as soon as I could. I just know too many people that got hooked on pain medicine for me to take that chance. So as soon as I could, I started going from 3-4 times a day to 2 once, and then Tylenol. So I recommend if you're 2 months out, don't be taking any pain meds. You don't want to fall in that trap. But besides that, you know your pain tolerance. See if you can get away with Tylenol. That's what I would recommend. And right now, that's what I'm working on, the scar tissue. And hopefully during one of my travel videos, I'll be able to do a little light jog, a little jump rope, maybe some jumping jacks. That's the next phase. Right now though, I'm not putting heavy weight on this. So this is the leg I put weight on. I'm gonna push up, and so I can do that. Am I gonna do it the other way? Nope, not yet. Maybe next video.